Hello, everyone, and welcome to another episode of Outright TV. I'm Jessica Stern, the Executive Director, and I'm pleased to be interviewing my friend and colleague and a person I enormously admire, George Ayala, who is the Executive Director of MPact Global Action for Gay Men's Health and Rights, from his home in Oakland, unless you've moved in the middle of the pandemic, and I don't suspect you have. This is my fifth interview for Outright TV. And I wanted to interview you, George, because we're in a coalition together, and I heard you describe the impact of the COVID pandemic on people who are HIV positive, people who are living with AIDS, and LGBTIQ communities you serve. So thank you for agreeing to join us today, and welcome.
Thanks for having me. It's a pleasure.
My first question for you is a broad one. What should Outright TV's audience know about how COVID-19 is disrupting and impacting HIV/AIDS prevention, treatment, and care for people who are LGBTIQ and beyond?
Thanks for the question, Jessica, and thanks for the opportunity to speak with your audience. We are hearing about how governments around the world are blaming LGBTI communities for the COVID pandemic. And that's sending a chilling effect in the global HIV response. And we're hearing now reports of members of our communities, LGBT people, being denied services, being asked to wait at the back of the line. We're hearing from people living with HIV, gay men, trans women living with HIV, that they're having a harder time getting access to treatments that they need. Governments really not implementing multi-dose prescriptions as a solution to shelter-in orders. We're hearing also that folks are now unemployed. They're worried about being able to pay rent. So housing stability or instability. They're worried about food insecurity, being able to pay other bills. And for folks who are in unstable housing situations to begin with, those situations are getting worse, especially among young LGBT people. We're hearing stories about HIV service centers and programs or safe houses being raided, an uptick in violence targeting LGBT people as governments blame us for the COVID-19 pandemic. There's an increase in surveillance being put into place to track cases of COVID, which I think worries a lot of LGBT people and folks who are in the HIV space. We've spent a long time advocating for stricter protections of LGBT people in the use of surveillance and tracking, like index testing as a strategy is problematic because it increases the risk for violence. And so we're hearing about that. We're hearing about people really using digital platforms to target LGBT people for violence, for outings, for blackmail. And then I think as a result of social distancing, we're hearing LGBT people really struggling with mental health issues, feelings of isolation and loneliness, depression, and then anxiety as a result of, increased risk for violence and discrimination. So those are some of the things that we're hearing, Jessica.
Wanted to ask you about the raids that you mentioned. On this show, we talked a little bit about the raid that happened in Uganda of an LGBTIQ homeless shelter. And of course, that case is particularly acute because not only were people raided in what amounted to their own home, the government conducted the raid in the name of public health. And of course, the people who were arrested and all of the LGBTIQ allies in Uganda understood that that was the pretense for implementing the long-held policy of state-sponsored homophobia and transphobia. I think you were alluding to additional raids Where else have you seen raids in the name of COVID-19 prevention?
We heard some stories about programs being raided in Cote d'Ivoire and Cameroon, where it's been difficult for LGBT communities. So those are some examples of other raids. We're hearing about police kind of brutality in the Philippines, targeting our communities and targeting people who use drugs. So those are some additional examples. In terms of kind of social media violence that are happening, you know, there are examples in Morocco and along North Africa and the Middle East that are really quite troubling to our communities.
Mm-hmm. Right. And of course, you're talking about a horrific instance where, ironically, a community member, an LGBTIQ community member in Morocco, who has a very popular beauty platform online, urged her followers to go out and out LGBTIQ people, I think mostly gay men.
That's right.
And commit acts of violence against them, which has had a terrorizing impact on the community there.
That's right.
I want to ask you for examples of governments that maybe have gotten it right, because that's actually not something we're hearing much about. And you know, I think we're very it's very important to name and shame the governments that get it wrong, but when there is a best practice, we also want to lift it up because we want to incentivize governments to do the right thing. So give us some good news, George. Are any governments doing HIV/AIDS response in the context of COVID well?
I think you know, the majority of governments are really trying to figure it out, right? Like I still think the verdict is out in terms of, you know, how governments are really maintaining a robust HIV response in the wake of COVID. So it's a little too early, but most governments, except for the ones that we mentioned that are not doing good, are really trying to figure it out, right? Like they're worried, legitimately worried about, you know, accomplishments, achievements, gains made really being lost if they don't keep their investments strong, and if they don't meaningfully and continually engage our communities as they make decisions about funding and about programs. So most governments are, you know, are really struggling with this and are trying to do right by it. I think where they struggle the most is how to figure out ways to engage, keep us engaged during kind of shelter in places, right? How do we operate virtually, where normally we would be in meeting rooms, feeding into, you know, plans and budgets and programs. Right now, because we're all virtual, given the shelter-in orders, it becomes tougher and tougher for governments to keep up a strong community engagement. So I guess the good news is that most governments are really trying their hardest to not lose traction, lose momentum in the global HIV response, to keep a targeted focus on those of us who shoulder disproportionate HIV disease burden, and not to kind of fall, you know, victim to this tendency to want to blame us.
Yes, that is a common trope in the history of natural disasters and other forms of crisis.
That's right.
I want to ask you if you have an example of an advocacy initiative that you couldn't fulfill because of the pandemic and what impact that had. Because you alluded to the importance of literally, you know, being in the same space as governments to remind them to care about and resource the communities that we serve. Was there an important meeting that you missed? Is there a crucial decision that was made that might have been made better or differently if you and your colleagues from MPact had been able to have easier access to influencing the agenda?
Yeah, it's a great question. I haven't given that too much thought. I would say that what's been hardest is that, we had all of these advocate training initiatives that were scheduled to take place this summer, and those can no longer take place, and we have to really now rethink those and figure out creative ways of convening people and bringing people together virtually. And maybe it's because I'm old fashioned in this way, but nothing replaces, you
So
know,
sorry, George. I need to tell you and the viewers of Outright TV that my partners just delivered soy milk and vegan chocolate chip cookies.
yay!
Just
I
blush.
wish I could share those with you.
I mean, really, when you have a butch who's at home with you every day, it's a joy. Sorry, Outright TV.
Lucky
I
for
had to
you.
share it. Wow.
That's lovely.
I mean, one of the joys of this is that we get to pamper each other.
That's great. That's really great.
Anyway, I'm sorry, you were saying something about the interruption in advocacy training programs that you were expecting to do this summer, so literally in a couple of months. And those obviously are
Yeah.
important because you're teaching community members to be stronger advocates for their own needs.
Yeah, not just teaching, but also creating platforms for peer exchange, right? Where advocates could teach each other, right? So advocates from Eastern Europe could hear from advocates living in sub-Saharan Africa, and there can be an exchange of strategies that make best sense. And while we can do that, we can facilitate those kinds of opportunities virtually. Nothing can replace the power of putting people together, right? Because when people leave those, they leave with long-standing relationships with one another, and I think there's power in unity.
Yeah.
And so that's I think that's a big loss. And as you might know, we were planning an alternative event to the International AIDS Conference,
Mhm.
which we've had to cancel because of the COVID pandemic. And again, that was an opportunity for us to bring community advocates together in a conversation about the importance of communities in the global HIV response
Yeah.
and the importance of our communities leading those responses. And so we're going to miss that opportunity.
Yeah.
The annual high level political forum that happens in New York is
Mhm.
now going virtual. And one of the concerns that I have and some other advocates have is that when those kinds of things get canceled, then how can we really perform the accountability in the follow-up of those meetings if they're not in person, right? If we can't be in the hallways, pushing our issues and having those side conversations, influencing friendly member states to take up stronger positions on our behalf.
Right.
So those are some examples.
Yeah, those are excellent examples. And I think part of the problem with the UN meetings going online is if you already had a foot in the door, your chances of maintaining communication with the like-minded states, the allies to your agenda, is pretty solid. But if you don't have a foot in the door, if you're a grassroots activist that was depending on access at the high level political forum on the sustainable development goals, um, or any of the other spaces, the Commission on the Status of Women, for example, you don't get access. You don't have those relationships. That's why you were going to the UN. And,
That's exactly right.
and on top of that, the governments that are not like-minded, you're cut off from access to, right?
That's
Um,
true. And there's less pressure on them, right? As a result, right?
that's
Um,
right.
the other two examples are Global Fund board meetings have been now moved to virtual platforms. And again, a similar thing is, when we don't have access, when advocates don't have access to members, governments, member states, we lose the capacity and we lose some advocacy traction, capacity to influence them, and then have them influence each other.
Thank you, George. I want to just note that we're at 15 minutes now. And so knowing my communications colleagues have a very specific idea about how long these meetings should go, I'm going to beg their indulgence. And I want to ask you a final question. And it's actually about funding for HIV response. Do you worry that governments will divert resources from HIV/AIDS prevention services and care because of the COVID crisis? And what are the solutions to prevent that from happening?
I am terribly worried about that, and the reason I'm worried about that is because we still have quite a bit of unfinished business in the HIV response, right? Mainly concerning gay men, trans women, people who use drugs, sex workers, and of course, like with most things, in the HIV response, we get left behind, and so as governments try to figure out their budgets and ways to kind of respond to the urgent needs created as a result of the COVID pandemic, it is likely that we'll see HIV budgets start to shrink. And that's going to impact our communities the most because of the unfinished business. And it's an important thing to pay attention to also because LGBT-led organizations in the HIV space get to do their advocacy work, get to do their community mobilization work, get to kind of launch the more difficult discussions around human rights and LGBT rights using HIV funding, right? And in the HIV response, as you know, we can't divorce, the health needs of our communities from the rights needs of our communities.
Right.
We have to do those together. And so I'm really worried. I think the solutions here are really kind of a staunch and an unwavering advocacy on behalf of advocates, and really supporting advocates to show up in ways that they haven't in the past, and to remind governments that we're running the risk of really losing any progress that we've made in the past few years in the fight against HIV.
Chilling words, but also very honest, and you're sounding the alarm, which we appreciate. I just want to lift up what you said, which is that we cannot divorce public health and human rights. And I think one of my fears about this moment is that there will be a rush to services. There will be a rush to find a cure. There will be a rush to invest in understanding the virus. And the first thing to be cut will be the human rights budgets, which were already too small before the pandemic.
I think right.
I want to wrap up by thanking you, George Ayala, for the extraordinary work you do. I want to urge our viewers to check out MPact Online. I want to say you've been putting out wonderful newsletters. Congratulations to you and your staff. You've
I
been
appreciate it.
Great resources, so our viewers should sign up. I want to thank you for joining us.
Thank you for having me. I really appreciate the opportunity.
It's my great pleasure. And viewers, please tune in for another episode of Outright TV. Bye, everyone.
Take care.